Various media houses have been dominated by reports that Muragijemana lost her kidney during a surgery at Mubende Regional Hospital. It was reported that when the woman developed complications after giving birth under the care of a traditional birth attendant, reports say that she went under an operation at Mubende Regional Hospital where she was rushed. 4 days after being discharged, according to reports, she developed stomach complications. She went back to the hospital for a scan. Medical workers found out that she had one kidney. She accused the hospital staff of being responsible for her missing organ.
She was scanned only to find out that the kidney was removed. When I touch my stomach, I feel pain.
We want the government to help us and find out where her kidney was taken.
The State House Health Monitoring Committee picked interest in the matter and started investigations. The executive director of the unit, Dr. Warren Namara, told journalists that there was no foul play since Muragijemana had lived with only one kidney.
She was also examined thoroughly by our doctors, Dr. Yela and the doctors from Mubende. We wanted to establish exactly what the truth was. This was to rule out incisions on the abdomen and other surgical incision scar on the lower abdomen. The reason why we look for that, in order to remove a kidney, you have to have a specific area where you cut. You just don't cut anywhere. So the examination found there were no scars other than the lower abdominal incision, which is called the bikini incision. This is usually done for mothers to deliver or to remove uteruses when they are sick. The incision to remove a kidney is way up in the flanks.
Dr. Namara advised journalists to seek the right information while reporting on some complicated matters.
As journalists, the current hype about organ harvest and trade is much more of a sensation than a reality. This patient did not have her kidney harvested. It was an abnormal, congenital abnormality. So the patient was never harvested of her kidney.
Dr. Stephen Atano, the Assistant Director of the Health Monitoring Committee, explains how a person can be born with one kidney.
Where there is absence, the absence can be 1 or 2. For this case of the lady, the kidney was established not to be there. And that condition, as director said, in Uganda, 1 in 10,000, but in the globe is about 1 in 4,500 cases, more common in boys.
Muragijemana's story gained prominence due to the fact that for several years, there have been reports in some sections of the media that the world under organ trade is thriving in Uganda. Flavia Ninkuze for CTV, PM Edition.